And
Okay, let's just make sure everybody can hear. Go ahead and just say something.
1-1.
We're good.
Okay, good. Okay, hello everybody. My name is Dr. Hudson. I'm a licensed licensed physical therapist in New York. I represent the cluster of offices already, Hudson Physical Therapy, which is in this building on the first floor, Riverdale Physical Therapy, which is 2735 Henry Hudson Parkway. And we recently opened another specialty location that is mainly specialized in women's health and excessive chronic pain, and also Century Building Suite 124. So today, as it was discussed priorly, we're going to talk about managing of a headache, also known as cervicogenic headaches at home. Basically, after today, I want you to understand what you can do, like little tricks and things, what you can do to avoid onset of the pain or help you with already existing pain. I'm gonna go through the presentations. If you have questions and you want to interrupt, just raise the arm, like ask me, and I will stop and then gonna answer your question. So feel comfortable. I want you to leave with some knowledge out of you. It's not just for me to be here to read the notes. All right?
I just want to know, would they have some paper so I can take notes?
Um,
On that room?
I'm not sure. Is that?
Sorry. You have some paper on the table.
Okay, any questions so far before we start?
I have.
No? Okay, we're gonna give a second for this gentleman to be ready.
Yeah.
All right. All right, let's begin. So, understanding headaches. So there's three major headaches that we know. It's migraines, tension type headaches, and cervicogenic headaches. Cervicogenic headaches, it's a main focus for today. That's one of the best and most effective with physical therapy type of a headache. Originates simply from the neck issues. Cervical spine, that's your neck. It comes from the Latin terms, triggered by the neck movements or poor posture, meaning bones sitting up, reading, or uncomfortable prolonged positions when the neck stiffens up. That's all can create the whole headache that can arise from the back of the headache and take all over the head. Pain typically could also go on one side of the head. You might feel it like just here or just here. Depends where's and how the spasm. In more severe cases, that's gonna go as I described prior. Okay, causes and common headaches. Migraines and headaches cause neurovascular dysfunctions, trigger hormonal changes, stress, sensory stimuli, lack of sleep, certain foods, meaning allergic reactions, anything like that. Basically, even the stress can get it. Maybe you get to that position in your life. You had an argument with somebody and then you walked out and you had a headache heavier than a rock. So that could be one of those migraine headaches. Tension type headaches is very close to cervicogenic because of the nature of origination. It comes from the muscle tension, stress, and poor posture. And you see the second one already that was a response to the stress. Your muscle stands up. Here's the obstruction of the blood flow. Some of the nerve may be compressed, and therefore you're going to be feeling the muscle spasm that's going to relate into tension headache. So it's not directly related to your brainstem or the spinal column. So therefore it says peripheral input and central sensitizations. Cervicogenic, as we said, spine dysfunctions usually on the upper part of the neck, C1, C3, that's your upper vertebra right here. We can actually palpate only C2, C3, not the C1. That's a very basic, and it's also called atlas. That's a vertebra on which your skull sits. Neck trauma, sustained posture. So, for example, can be caused if you had a little fender bender while driving, and then it wasn't really bad, but after a week, you're starting to feel why my neck is seizing, why my head hurts. Personally happened to me, and 7 days after it started to hurt, I couldn't tie it to anything until I remember, I remember slight bump in the back. So those not always directly related to stimuli response. So sometimes you can have the stimuli, meaning your argument, your stressful situation, or the physical trauma, and then you have a response of the pain several days after. So that's also common to understand, hey, I did not do anything, why do I have a headache? You not only have to analyze what you did today or this past hour, you have to look back, hey, what was my last week if you cannot find the answer that matching before. Biomechanics and headache mechanisms. So migraine, dysfunction in the brainstem nuclei. So trigeminal vascular pathways involvement and vasodilation and neurogenic inflammation. So what all that means? So the dysfunction is coming from the central nervous system. For example, a flare up of trigeminal nerve. Trigeminal nerve is go about like this. So sometimes you might feel the pain along your jaw, on the side, or side of the head. So flare up may cause the migraines. So that's gonna occupy. Also, if you have a neurogenic inflammation, something flares up your neural system. It's more severe diagnosis. I'm not just gonna throw the names because like MS and ALS, but even simpler flare-ups may cause it. Tension type headaches, overactive pericranial muscles. So meaning muscle spasm, simple words, it's overactive muscle. So when it's having neurological stimuli or trauma stimuli, squeeze it and stabilize it, or even something happens that your brain feels, hey, my spine is not too stable, I want to stabilize it, I'm going to squeeze it. Because some of it could be a protection reaction, could be herniation, could be something else. You want to protect, or you lift it even something heavy, and that a lot of muscles of the shoulder are attached to your neck. So when the brain register, okay, there's too much pull on my neck, I'm gonna stop it, I'm gonna seize it, meaning I'm gonna spasm and make sure nothing moves, can cause the headache, tension type of headache. And similar situation goes with the cervicogenic posture, but cervicogenic majority of the stimuli is a poor posture. What is so important about poor posture? If I'm sitting here, it seems to be okay, but the difference is if I'm standing like this, my ears over my shoulders, it will be about 25 to 30 pounds. As soon as I'm starting to become here, it's 35 pounds and up to 60 pounds when I'm here. What I'm talking about, the weight of pressure and tension on my muscles of the back of the neck. So I almost doubled the force placed on my muscles by changing my position. That's why posture is significant. Now, simple experiment. Take a couple of pounds, hold it in front of yourself, and see how long you can hold it. Here, you're gonna be able to hold it for hours, even the phone. Here, my outstretched arm, I'm gonna stay probably 15 minutes, then my arm gonna be heavy. It's not even a pound. So that's the same thing goes for your neck. Here, standing, you have normal distribution of weight over the spinal, over your spine. It takes up a little bit of a slack, somewhere with muscle working to make sure it's not blobs forward or back, because they're constantly working. But the main force is on my skeleton. When it goes here, it yanks on my muscle in the back and tendons. So they have to overwork, they're getting stressed, they're getting tense. Poor day in the office, basically, at that. So that's the mechanics, what we're looking for. In physical therapy, we're looking into assess you what's happening, what's causing your headache. So we help you to find that source, and we're starting to teach you how to get out. Over there. Okay, role of physical therapy. Reduce the headache, intensity, frequency, improve neck mobility, posture, strengthening musculature. So the point is how we do it. We do it through exercises, through education, and through teaching you small tips and tricks what to pay attention to. It's not you come to us, we fix you, you leave. It's a common work. The best results done with those cases when people come to us, work out with us, getting the therapy and modalities, what they need to get out of that cycle of pain that they are in, And then they able to go on their own at home. Plus, while they're going in therapy, they starting to work out when we need, when we feel comfortable giving them homework, what to do at home. They start doing more stuff at home, and that's the best results. People sometimes come in, oh, you help me so much. I'm always telling them, it's not just me, it's a 50-50 work, same as any relationships, it takes two. So it's common work, we guiding you through that process. Sometimes we have great results, sometimes it's going through the flare up, especially when we're dealing with the chronic conditions. It's not always a straight highway, it's a bumpy road, but it's a road to a better future. It's a road to a better state. So what's the benefit of it? Promotes self-management, you become more aware, we can teach you how to avoid it if it's possible. Some cases we can do it, it depends on the severity of the case. And we able to arrive to what actually the cause, versus just saying, hey, take an Advil or Tylenol to stop it for next 2 hours, and then take another one to numb it. That's never addressing the root cause. Even when you're hearing and taking like, hey, I'm gonna take Advil to take out inflammation. Oh, I took Advil, pain stopped, probably I took out inflammation. I no longer have a problem. A day later, I need my Advil again. It's not, it's numbing. It's never addressing the cause. It's not never taking the habit that's causing them. So therefore, effectiveness is very short term. Physical therapy on the other hand, and will take a little bit longer to respond because body does not heal fast, especially if the problem was there for years. It's not going to be gone in 5 times. It's going to take some time, but it's also re-educations. You're going to feel better. You're going to work on other elements of your body. You're going to make sure you address it properly. And it's not invasive. Nobody need to cut you open to switch things or fuse it unless that's a prerequisite. Sometimes we're starting to work with people when it's too late. And what we do for them, we actually prep them for the surgery before, because it's called pre-rehabilitation. So it's we're starting to work in a pain-free or minimal pain levels when we making sure that you improve your blood flow, you improve the muscles you have existing, and making them as strong as possible in this case. So when the surgeon goes in, he has a nice distinct muscles. So he sees, hey, this muscle is working, this muscle is not, this is actually the problem. I have a good blood flow that secures, that makes sure that the rehab after the surgery goes much easier. Those people who had prehab, doesn't matter, spine, knee, they always recover much faster. Unfortunately, it's not always a fairy tale like that goes smooth, but they are on a ballpark way easier recovery than anybody else who came in that state to the surgery, went to the rehab after. Okay. Okay, evidence from research. So I'm not gonna go into more details, but just a couple of points that there's a lot of research indicating that there's a good benefits from physical therapy addressing the neck pain. And also research indicates, just to give you a ballpark, how much it really takes to respond. So it takes 4 to 12 weeks. That's what the research is looking into. It takes about, it could be 6 weeks. So it's not that fast as you see. And it takes more than one or couple of visits. So, yeah, majority of them, I had a couple of them repeated, but you need certain time. Why it takes so long? Because it's only 4 weeks until the regular muscle exercise when you can see a significant change on the muscle structure under microscope. Yes, if you go to a gym in the first 2 weeks, hey, I can do much more, I can lift more weight. It's just mainly because of the neuromuscular change. It's not because of the actual muscle physical change, meaning your body learns to activate the muscles more effectively. When you're having an actual physical muscle change, when it swells up, becoming a little bit bigger, it takes at least 4 to 5 weeks of the regular work on it. So therefore, when the serious exercise change or a shift, it takes time. And all the good things take time. So, yes,
Yeah. When you mentioned Advil, that's ibuprofen, right?
Advil usually, I believe so.
And anyway, I have the neck problem where I get migraines from the neck. And a therapist that I consulted with said I should take 800 milligrams of ibuprofen per day for 7 days to break the cycle, of inflammation. So I was wondering if, and then another doctor said you can do like 3/4 of that, 600, with regular tablets. So I was wondering what you think of that. Would it be beneficial?
So I do not prescribe medication since it's
Yeah.
beyond my scope of practice yet. What I can discuss, and it's strictly for informative part disclosure, not prescribing, not declining or anything like that. All I can refer you, if you want to change anything, you talk to your physician, whoever prescribing, that's only from that change you can address it. So as ibuprofen being prescribed, it does take about 7 to, I believe the lowest I met is 4 days, 4 to 7 days, it's a lower part, to 12 days, it's a course when they prescribe it. 800, it's a lot, so probably you have a severe headaches.
I do get severe.
So, because it's a lot, it's usually what people take when they have a knee replacement, hip replacement, and they are like just getting off the oxy and getting into like normal medication, so it's a lot of numbing. Yes, it does break the inflammation cycle as per research into ibuprofen, but that's one of the ways. We going back to the cause, it will not address what caused the inflammation. So yes, it will break the inflammation, you might feel for some time much better, and then if the cause is not addressed and the problem of it weak musculature. Lo and behold, it's gonna come back eventually, and usually what's happening is coming back much harder. So usually the similar situation goes with the lumbar pain, like pain in the back. Oh, I got this shot initially, it helped me for 6 to 12 months, I was feeling good. In 12 months, I need to go back. I got the shot, it helped me for 3 to 6 months, and now I got 2 shots and nothing. So that's usually short-term solution. When those, I usually talk to my patient about that. Hey, I was prescribed medications. If you need to work, if you need to do your thing, if you need to travel and you need to address it, you have no time or ability to modify your schedule, address it with the physical therapy, follow that, and we'll take from the point where it is. Sometimes we have patients, hey, I cannot tolerate pain as much as needed to go through the therapy. I'm saying, no problem, medicate yourself before as per physician prescription, and then come to us, we're gonna do what's needed, and that's how we're gonna work through it, because people on a different level. Some people can have a little bit of a headache, they can tolerate it, going through it, some people cannot leave the home. We had those as well. So it's very individual what you need to do. Some people, hey, I wanna make sure I can deal with the pain first, and then I come to PT, it's your individual choice. And you're looking to pretty functional, so you can do whatever your physician prescribed you and start physical therapy to make sure when it's gone for good. That's my thing. So, yeah, all of them. Also keep in mind, all non-steroidal anti-inflammatory, that's gonna be Aleve, Tylenol, ibuprofen, naproxen, all of those affect your stomach severely. 800 is a lot. That's basically a borderline.
Yeah, another doctor says.
So
600.
pick whom you listen to and make sure like, hey, maybe there's a lot of non-steroidal coming with the formulas of protecting for your stomach, so they code it differently. Speak if those options with your physician available to you and needed, because it's also preparation into way what's needed, what's good for you, what you tolerate, what's not. I'm not familiar with the coating types, so I don't even know the names for them, but I know they exist. So that's something to discuss as well, to protect your stomach a little bit, because it may upset your stomach significantly, and that's another problem too. So our idea to get you less problem, not more.
Yeah,
So,
thank you.
any other questions before I move into a little chin back self exercises? Excuse me? Advil and Tylenol, as I said, I'm not a physician, I'm not able to go and give you directly, but for the entertainment purposes and just for information purposes, what you can read about is basically principle of work. So the blockages of certain element released in the body versus elements, how they work, the mechanism of work, even the action of pain stopping is more or less the same. But how they get through it and what channels they're using it is different. So for example, Tylenol is not as bad for your stomach as Advil. So, or naproxen or ibuprofen or Aleve. So therefore, a lot of people being recommended Tylenol, but it does have its own side effects. So it's Tylenol is usually less, less research than naproxen or ibuprofen. That's another point. So they still not exactly sure how the process is going in the body. So that's the difference. So they might see, okay, you have a lot of blood pressure, a lot of naproxen can trigger, or Aleve can trigger your blood pressure response or sugar elevation versus Tylenol is not as severe. But as I said, before changing anything, speak to your physician. That's a must. They know it more better. For me, I'm just giving you points to research on. Anything else? Yes, please.
My problem is, first of all, I don't like taking medication. If I can do something with my body, that's what I like to do. But my problem is this, I'm sitting here now and my shoulders are already back. And they keep going up and, you know, it's like, I know it's tension and what you said about things you think, and I think that's what it is. But I do roll, and I do every morning, 10 of everything. But still during the day, I could just be relaxing, but my shoulders are up, and I have to let them down. And that's so, aggravating to me, why I can't be at a state where I just relax.
So I'm just gonna repeat the question for auditory online, so just everybody in the same spot. Question is, the present lady here, she's sitting and she feels like her shoulder stands up as she's sitting. Even though she's doing exercises at home, she's doing rows, moves around about 10 of everything every morning, but still, right now, sitting watching the presentation or anything like that, she feels her shoulder shrugs up. So what's the reason for it? So first of all, as you mentioned at the beginning, it's not a problem that you cannot don't like medication. That's actually good for you. So at least from my standpoint, unless physician said otherwise. But what's happening? So in this underlying, in my experience, usually it's an internal anxiety, so and stress. So your body constantly in overdrive. So in those cases, what we do, we use vagus stimulation. Vagus nerve, it's a nerve that's responsible for your parasympathetic system. So we have a autonomic nervous system, which consists sympathetic and parasympathetic. Sympathetic, fight or flight response, parasympathetic, rest, relax, digest. So if you're constantly in the fight or flight, your muscles in a constant overdrive, you're intense, as if you're gonna get into fight right now every second. And it doesn't have to be happening in your brain, it just underlying into your subconscious that your body constantly fighting something. It's either internal psychological blockage or anything like that. So it could be multiple reasons there. So your body in constant overdrive, as if you're gonna run the marathon at any second. So that's gonna put you in that tense state. Now, parasympathetic, what the vagus stimulation does, it shuts it off. As you're stimulating the nerve, it's forcing body to come down, to relax. So that's one of the therapies when we offer in Riverdale to help people who's having high anxiety levels, to have a poor sleep quality, not able to sleep through the night or wake up multiple times at night, or woke up and they cannot go to sleep because the thoughts are chasing. So that will help to calm down. And then you have to think that, oh, he said psychological or anything like that. It's not that you made it up. It happens in the unconscious. It's very hard to affect, and it affects the whole body. If it's going for years, if you're constantly living in stress, your body becomes tense. Your body, it's your prominent and response of your psychological state. If you're in stress, your body will be in stress. If your body relaxes, which is a good sign, your brain will relax as well. So it's a two-way street. So a lot of things that we're trying to work in effect is if we see, we're not doing counseling, but we're working through the body and helping you to feel your body, that will help to calm down your brain and calm down your nervous system, to stimulate the parasympathetic system to get you into more relaxed state. So this is more combination problem. So it's a strength definitely, because if you constantly stress, your muscles getting weaker because they're constantly working. But they just needed proper load to start building up the muscles and vagus stimulations to calm down the nerves inside. So that's the two things that we would do in this case. Okay, so there's gonna be 3 light exercises that you can do in order to help yourself on the basic thing. You might feel a big difference, you might feel not so much big difference, but you definitely can benefit from that. Usually, in this case, you have 10 to 15 repetitions for 2 sets daily, meaning you can do it 2 sets once a day. I would recommend twice a day. Start doing it regularly. You're gonna see the change over time. If something not changing, you're welcome to come in either of the offices and bring up your concerns. It's more for general exercises, so they might not work for you when you come into the office. We're more doing more specific evaluation and determining what's good for you or what's best for you.
One more short question. I noticed that, you know how you inhale and exhale, and what I found out through the, rushing around and anxiety, feel like I can't even like inhale and exhale, and I'm trying to do it when I wake up in the morning, but look, it's the hardest thing, because one way I was leaning forward, it was like to me, everything here was laying on my, and then I get tired and I have to sit down after walking a half block. But I noticed that when I tried to learn to exhale, which I see it's a simple thing, but it's hard for me because the anxiety has been all the years mostly of my life. And now I'm trying to get rid of it. So inhaling, it seems like it makes me a little dizzy when I try to, and then let it out. And then I said, well, do it just a little bit. And I noticed that little bit helps, but what can be done to help me more with my breathing, because it affects my walking and, like you said, straightening your body.
So this is a little bit more like a complex thing than just here's one thing to address. So the question was what can be done if you're anxious and you have a hard time breathing in, breathing out because everything tensed up. So it same thing happens. So your diaphragm, it's a muscle that under your lungs, and it's responsible to open up the lungs to let the air in and squeezing the lungs to push it out, same as your intercostal muscles. So all of that works in sync to open up and close to let us breathe. What's happening when everything, if you in a high anxiety, you tensen up, so you see your shoulders tense up, same happens to your muscles around here in your chest. That's what's blocking. So it's has to be addressed together with everything that's working with you specifically in the specific patterns of movement and incorporating them into daily life. That basically has to be done. It's a long work, but it's a doable work to address that. It's not just gonna go away. So some of the things that you can do with that, like control your breathing, because breathing is very, very actually strong exercise to do. Like, and you did a good thing when you started to work with it. You can just also stand up, hold to something, conquer top, bend a little bit over. That's gonna help you to engage more accessory muscles for the breathing and go through it. Breathe in through the nose, hold it for 2 to 3 seconds and let it out. Don't just force it, just let it out. See how it goes, because you tense out, everything is gonna want to run away. Then try to breathe in through the hold it for a few seconds and then let it out. So like you're going through a little bit of cycles, but keep in mind, since everything's so stiff and you're trying to relax, the blood will rush into your brain, you're gonna get dizzy, let's all come in. So it's even with those light exercises, you have to dose them. Something like people don't understand, oh, exercises are good for me, let me start running. 2 months after, like, oh, I ripped my Achilles. Like I actually had my patient yesterday with that, like, it was like, because majority of the new runners are getting injured within 2 to 3 months and stuff. So that's right in the ballpark. So like not all the exercises equally beneficial for everybody. So therefore, when you come into PT, hey, I know everything and just about how to make it. Same as cooking. You can have the tons of best ingredients, but if you don't know how to put them together, you're gonna have something that you really not gonna enjoy. So let's do chin taps. Very common exercise, very frequently done, very frequently used in physical therapy. Majority of the offices in the beginning will instruct you to do it. I just want to give you my take on it and a couple of points how to do it. So. You can see from the side, but. So what you're doing is you're sitting up straight, trying to like as straight as possible, keep it up. Brace yourself so you straight up, sitting up. Then you're doing a chin tuck like this. Important part not to look up, not to look down, but pick something on the level of your eyes. Eyes will help you guide your head better. So because if you look up, you're automatically gonna go back with top of your head back. If you look down, you automatically will chin tuck too much. So you're picking something on the level of your eyes as just retract your back away. So if it's a wall here, retract it back here. So that's back. You're holding it for 5 seconds back and then simply relax. You're not pushing it forward. You retract it back, relax. Retract it back, relax. Retract it back, relax. You're gonna start feeling a little bit of a pull over here. That's fine. That's actually what we're looking for. You can repeat it for 10 to 15 times, 2 sets daily, and I would do it even twice a day. You might feel a little bit sore a day after. That's absolutely normal. It's gonna go within 24 to 48 hours. Okay, that was clear with the chin tucks, right? Anybody need the guidance? All right. Scapular retractions for the posture. Sit stand or standing upright, squeeze the shoulder blades back together. You can do it in a couple of ways. You can do it like this, squeezing the shoulder blades. So like this, retracting back, relax. My relaxed posture, retract back. So as you're feeling it, keep in mind, you don't want to reach it up. The shoulders go back and down. They don't go up. For you especially, it's like if you're gonna go up, you're just gonna facilitate your shoulder spasm. So it's very important back and down. As you're trying to imagine somebody pulls here, so it has to be back and down. You have to feel muscles between your shoulder blades. You have to feel that discomfort. It's like achy feeling, like somebody wanted, like you want to scratch there. That's exactly what you're looking for to move those muscles. Those muscles are very poorly used because majority of the things we do throughout the day in front of us, we rarely do like this. We rarely open up. Another way how you can do this is simply open up to the world, open up to the sun, like with your hands. It will help you to retract your shoulder blades even more. Like you can do it, open up, movement, big movements, and also a little bit liberating for the body. So you're engaging the muscles in a way that they haven't been engaged in a while. Yes, please.
You squeeze your shoulders together
Yes,
in a way,
yes,
just like that.
yes. But a little bit back and down. So you see, like when I'm doing it, this part go up this direction, not front. Because there's the front, this is better. You're engaging more of your back. That's better. Hold on a second. Yeah, you're lifting them back. You have to open them like this. You're looking to feel it right off the hip.
Thank you.
You're welcome.
Yeah.
So the mistake was to do this. This is not the thing. It has to be back to. You can do it in front of the mirror. The idea is your shoulders should not go even a bit up. They have to go back. It's simple, but it takes a repetition to feel. Okay. Towel rotation stretch. So I don't have a towel here. And I completely messed up. So you taking a towel, you put one end here and you rotate here. If it's gonna look like this. Imagine this is a towel, take a thin towel. You're gonna hold one end here. With this end, I'm gonna rotate here. Straight and turn. You can hold 30 seconds, it's here, but 15 seconds is enough. Very light. So you see, I'm placing it here, so another turn. This is in front of me. I'm not doing this, I'm not choking anybody.
No.
So this is on the chest and I'm turning to the opposite side. Yeah. Like this. And you can hold it for 30 seconds. You're repeating it both sides at least a couple of times. You can do it daily. You're gonna feel a nice good stretch to the muscles. It's actually one of my best and favorite exercises for the neck stretch. And
Oh, did you, cause nobody online could see you
for a second, probably.
while you were doing demonstration.
Oh, okay. I'm gonna step out. I'm gonna repeat one more. Okay.
Okay, so let
Just
me-
tell me
let me
if they
switch
can.
this. Let's switch the, we just have to
Okay.
stop the share and let me switch the,
Can they see me now?
yeah, stop sharing. Just stop share and then they can see.
Okay. So I also can be able. So the stretch be like this.
Now we can see it.
Yeah. So I'm gonna imagine this is a towel. One end is over here on my chest. I'm not crossing into the opposite side, straight down. Now I'm turning, and as I'm turning, my shoulder girdle stays on spot, but my towel turns my jaw and my head to the opposite side. And back to the center. And here again. For about 30 seconds, hold, 15 seconds is enough. And backing up. Now, other side, I'm gonna put it down to the chest here. This one is gonna be straight. Turn the opposite way. Good. Like this. And every time you do just 15 seconds, hold, 1, 2, 15, slowly back. Everything is done very slow. Every one exercise out of this 3 is done very slow. Let me see one thing. It's real almost done. In general, you want to be as mobile as possible. There's not much on the presentation, so I'm just gonna run through it. Literally 2 slides. So you have to be mobile. Motion is lotion is one of my favorite sayings. Because especially joints, they move and grease themselves out by moving. They don't have vessels inside of them. It's a synovial fluid that greases joint surfaces, and that's what's gonna make them move. That's why it's when we wake up, it's like, oh, everything is stiff, but like within an hour or 2, we already, okay, better, more oiled, more better machines. So that works not only for the machines, but for human as well. So it's just simple mechanics. We need to move in the different areas. For example, for those who say, oh, I'm doing exercises 10 of everything every morning, why do I have a problem? Because you do the same exercises over and over for years now. You need to switch the routine. Example I recently started to use is like my wife, she's a professional athlete, and like over time she was going 3 times a gym, and she's like, oh, my knee is getting weaker, but I'm exercising. What, you gotta switch your program. She switched the program to something that she completely never done. First of all, she was feeling beaten up because everything was hurting. She used the same muscles that are strong, but she used them in a different way that they are not used to. It's very big difference. The reason is, like, if I'm holding it like this for 20 minutes, my arm in front of myself, I can do it here for 20 minutes. Over here, I'm gonna be able to do only 5 because my muscles are weaker. I'm not doing too much work in this plane of work. But here, it's like same muscle, same stability, but they engage differently. Different angles will engage it differently. So same as the car has its stronger sides and weaker sides, same as body. It has a stronger side and weaker side. So in physical therapy, we identify those weaker sides and we help you to build it up. Consult a physical therapist if you have headaches that continues, pain that worsens, and you need personalized care. We're usually going with the similar exercises to a lot of people, but we tailor them individually for you, for what works with you. We're always encouraging communications with each other and with our patients, so you always heard. And
see your slides now, yeah.
No, that's okay, that's a few slides, the last slide, I'm just gonna give you a summary and that's it. PT is just takeaways points, is a physical therapy is effective managing source and tool for cervicogenic headaches and all the types of the headaches. The more you do home exercises, even these 3 exercises, I think they're gonna make a little bit of a difference in your daily life if you're gonna start being consistent with them. See the result probably by the end of the next week, if you do them consistently. And seek professional help when necessary, not only PT, but general physicians. If you're not sure, you can always come to PT, and if we see that there's necessity for additional professionals, we always refer out. Sometimes it's a ortho, sometimes it's a neuro, sometimes it's a general physicians, because the people coming with different complex problems. And it takes more than one doctor to fix it sometimes. So, any questions? Too much? All right, so I hope today's sessions will help you to be more aware of your body and how the process is working in your body. Well, I hope that exercises you're gonna do, they're pretty easy. They are gonna take more than 5 minutes of your time. So I'm sure you can spare 5 minutes for yourself. At least you deserve it, I'm sure, every one of you. So please do that. I hope to see you
We have
next
a
time.
person who's a question online.
Yes, please.
Phyllis, if you want to you have your hand up. Did you want to ask a question? You have to unmute. You're muted.
Okay, can you hear me now?
Yes. Thank
Okay.
you.
My daughter-in-law has a terrible, terrible problem with migraine headaches, experiencing it for a long time and seeing doctors, seeing neurologists. But the strangest thing came up recently. A friend told her that eating French fries and coffee would be helpful. And she actually tried it and it was. So is there any relation
Is that,
that
what's
food,
that,
any kinds of foods
Gleb Carf.
that would be
Gleb.
Yeah,
I can get.
so-
I think his card is on the.
yeah, this
table.
card is, but it's.
Barbara, we can hear you.
Yep.
So Phyllis, is there any more to that question, or that was the question?
that's the question. Any
Okay.
relation to
So
food and
if there's any relation to the food and headaches, so first of all, I'm sorry for your daughter that she's in this situation, and how long did the headache persist?
it's been years.
Okay, so generally, so coffee is working as a vasodilator and then a vasoconstrictor. So to give a better relationship to that, plus French fries will have a lot of sodium in it, so which is also blood pressure stimulating. So you have a too heavy foods that stimulating the blood pressure in the body that may level out the headache. If the headache is related in relation to vasoconstrictions, meaning when your vessels like constrict and shortens, so it also can create the migraine, and you stimulate your body through coffee and French fries. So you're putting a lot of sodium, putting a lot of heart stimulation, and that stimulates the blood flow that might counteract the cause of the headache. And that could be the relationship that it's working. That's one of the hypotheses that I can come up right now with.
Yeah.
But it's more deeper evaluation into it. Plus, we need to understand which medications are helping her, because if she's taking medications that are helpful for her, so based on how those medications are working and what they're addressing, that how we know like what's counteract. But none of that will be curing. It's basically short-term relationship, like short-term turn off the headache by stimulating blood pressure, but then it's very dangerous for the
Yeah.
heart in the long run. So
Okay, thank you. That
definitely
I
need to
really
look
appreciate
into-
your reviewing that. I took some notes.
Okay, but definitely long term, it's very dangerous because I'm not sure the other elements of the heart and if it's plausible solution for that case.
Yeah,
Yeah, so that definitely she may be, if she's in an area that was step by to be evaluated, if that's the case, we're probably gonna be able to suggest something in addition to it. Because there's something underlying there, why she's having such a vasoconstriction reactions and cause for the headache. That explains the cause, basically, what I'm talking about.
yeah. Okay, thank you.
You're welcome. Anything else? Any other questions?
Okay, anybody else online? I think you're good.
Okay, thank you very much. Thank you, everybody.
All right, thank you very much. Take care.
For including us on Zoom.